joining again. Thank you for joining again to start the second module, the second presentation for Research Training Lab at Larkin. From the last module that we shared with you, last presentation, we have received some information from your end about your interest, your priorities, your issues in the departments, in clinical practice area. We were so eager to receive more information, more questionnaires, and on time, to be able to analyze these kind of issues and have a list right now for you to show here that we have received a list of issues. But the few questionnaires that we have received that I have right now with me here, a print of that, if it shows, I have a print of all topics that you suggested, that you proposed, and Dr. Shruti Patel tried to gather and collect all of this data through hard working, she tried her best to contact you, to communicate with you, to have your questionnaires. And we know that your time is limited, but please keep in mind and consider this fact that this is a research training lab. It's not a lecture presentation. It's not a workshop or seminar or webinar to participate 1 hour or 2 hours and that's finished. It's a training lab. So step by step, we need your inputs to incorporate in the next module. For example, for this second module of our training lab, we needed to have all topics, priorities, your prioritization methods, and the output of your worksheet to build on the next steps on the things that you suggested us as your research topic, as your research title. So the next step would be based on your research topic. We need those worksheets, prioritization model, your scoring, and the finalized 3 topics. So after that, we will be able to mentor you, to help you to form and to shape your projects. And at the same time, we will have 20 projects. Simultaneously, we will have more than 20 projects with together. And that's a cohort, that's a journey together. It's not only presentation. So please keep in mind and contribute to this training lab. Communicate with Laura, with Shruti Patel, Dr. Ricardo. They are working hard to communicate with you through Telegram channel, and also your emails, your phones. We know you are too busy, but that's a priority. If you were not ready to play the role of a liaison, to be an active researcher with us, that was better to invite other people with you or as a substitute of your role in your department, because that's important. And we are spending a lot of time to plan for this program and to support you. We will be so eager and grateful if you let us know our issues for improvement, because that's the first start and first try and effort at Larkin to establish this network and train many people at the same time in different departments. So it's important for us, help us to improve the plan, improve the program with your contribution, on-time contribution. So for the next module, for the next worksheet, we will have a short deadline after this presentation. Please send and submit your worksheets, 2 worksheets. If you haven't still submitted your first worksheet, please submit both of them to Dr. Shruti Patel and Dr. Ricardo, that both of them are here. Am I right, Dr. Shruti? Let us know.
Yes, doctor, I'm here.
Dr. Rishba, please. Okay, thank you. And Dr. Ricardo, he's not with us. Okay, you are here. Okay, great. So, and Dr. Nazish, those 4 people are our team at research department, ready to help you, ready to communicate with you, and ready to schedule a visit directly and closely with me. So we will have meeting with your small groups to support and mentor your projects and move forward your projects, your ideas to a project, to a research, and then to a publication and implementation of your ideas. Let me share a slide presentation for today. The next module of your program is issue statement. We are here, research issue statement. We discussed how to identify research issues and topics, how to prioritize. Those were the learning objectives of last meeting. But now we are working on how to state the importance and how to highlight and magnify, amplify the necessity of your research in your department and in your workplace, or improving your clinical practice, competencies, and skills. So we are here right now. Let us discuss about how to state an issue. Okay, we had a list of issues last time, a list of issues. Many of you developed some ideas, suggested some topics. For example, from Dr. Let me bring some examples of your ideas here. From Dr. Sabine, we have CBT, cognitive behavioral therapy effectiveness and cost effectiveness, and management of missing cognitive behavioral therapy during addiction. Those are some topics, some ideas, okay? Now we want to develop issue statement that is an introduction to our topic. I know that our presumption is, so we will explain, we will describe the issue, we will search a little bit in Google Scholar, in PubMed, in everywhere that we have access online, and then we will write a paragraph or 2 paragraphs. But that's not so easy. It's the most important part of your research program. And the quality of your work, quality of your program is totally dependent on your understanding in this first step from the issue, from the challenge. It's the rationale of the study, and it should provide best available facts and evidence, not just an explanation or description, some playing with words and terms, scientific terms. It should be the best available, a representative of best available facts and evidence, and it will represent your understanding of the topic that you selected. How? Let us discuss it more. The first part of the introduction of the issue statement, that you can find it as background in proposal, introduction in paper, or issue statement in proposal, and both in a paper. So this section would be equal to background and introduction in different scholarly writings. It should provide some reasoning and rationale about why does this topic warrant a research sub-project, and why it explains and it defends and justifies the time and energy that we are putting into the research. And what would be the additional value of this research? What drives the selected research project? Is there compelling reasons for the research? persuasive enough for identifying problems as a basis of the study, or you can sell the issue and problem and the project data and finding later as a basis for a solution. Does it work? Is it worthwhile to provide some infrastructure for a solution later, to prevent something, to solve something, to anticipate and project something, to predict some scientific contributor factors or signs or symptoms about a disease or about a challenge in community health status? So it identifies gaps in the prior research, in the research, and reports have been done before previously. So you should identify the gaps in addition to explaining and description of what have been done before by other researchers. You should identify the gaps. You should analyze the gaps. You should find some shortcomings and issues in our current literature to support the importance of your research project, to justify why you are starting your new research. It might address a dark angle of a known issue. Maybe it is a known issue, but there is some dark angles, some unknown things, some under question parts of a known issue. Or it should provide connection between the problem and the reasons for the study. Connections are very important. Sometimes you are describing many factors, but how they relate to the main issue, it's important. Many times I'm saying students or medical graduates or colleagues or our team members that a good issue statement is not combination of pieces of information. You should not combine many pieces of information without a mental plan, without a good rationale, without good connections. A good issue statement is an issue statement, a descriptive description of an issue or challenge that connects the contributing factors, the cost, the economic impacts, community health outcomes, personal health status, consequences of the disease, adverse events of the disease, and many other factors at the same time. And it's able to describe the connection. It's very important how to describe the connection between the factors and the influencers and how they affect the phenomena, how they affect the issue, how they affect the challenge or the main topic of the research. So we should move forward into two steps of writing an issue statement. The first step is why this issue is important. And the second step is what will be done during our research and what would be the additional value of our research. Imagine your central topic, your main topic is COVID-19, something relevant to COVID-19. That's an example only. It's not very specialized and customized, but just as an example to be general with all of you from different departments. Think systematically about the main topic. It's COVID-19, it's a virus, it's a pandemic, it's something has affected all of global people, but there are many things around, many contributing factors around these disease condition. One of them is SDOH. Anyone knows what it stands for? Please unmute yourself. It's social determinants of health. Social determinants of health, like people education, people income, employment, housing, economic status, living environment, workplace environment, mental health, mental status. So there are many factors that can influence and affect the disease condition among people who are affected by. Personal immune system. Immune system is another contributing factor. Different reactions to a same virus among different genetic backgrounds, genotypes, races, ethnicities, different personalities, underlying diseases, comorbidities, immune system changes, and different patterns affects how the patients struggle with COVID-19 signs and symptoms and consequences. Social behaviors, what happens around the person, crowded cities, crowded communities, families with more children, employment environment with more people, crowded workplaces, how people behave each other, the level of information, health literacy, level of education of colleagues, family members, all affects, personal lifestyle effects, pre-existing conditions and disease effects, vitamin D level effects, genotype we discussed, many things around a phenomena, around a disease condition influence how a person who is affected and infected replies and responds to this condition. So when you state the issue about COVID-19, considering all of these contributor factors and explaining things that are relevant to the issue is very important to see all relevant contributing factors, particularly the contributing factors that deals with equity and disparity like SDOH, or personal issues, personal lifestyle. Those are socio-ecological rationale for issue statement. It's not only inside the person or inside our bodies. There are many things relevant to families, relevant to community, relevant to pre-existing disease and factors in a person that affects the disease condition and the treatment and any type of progress with treatment and solutions for disease conditions. So be a systems thinker. There is no separate phenomena. There is no separate variable in research, in a scholarly activity. Everything is relevant to many other factors. Even in our disease condition, when our body is influenced with a virus, with a disease, with an immune system threatening condition, everything would be relevant to each other. Our subsystems of the body will work together. Here is a social system. That's how a local hospital should work with a clinic, should interact with family, should interact with patients, with nursing department, with emergency department, continuity of care. After that, with long-term care, everything is relevant to each other. There is a social system, but there is similar interactions and interconnections in our body as well. When a system is at risk, all of other systems would be influenced, like just assume thyroid function disorders, how it affects all of other systems, cardiovascular systems, mental health system, and many other systems in the body would be affected. So in a good issue statement, you will address many things around not just a system, not just a central issue, but many relevant things, many relevant contributing factors, underlying factors, influencing factors around the disease and around the condition. So I want to show you something new. I found it on BMJ, that is a very high standard journal. Illustration and visualization about issue statement is a new component of this journal. You see here, to illustrate COVID-19 and adverse events, you can see this component in the first page of the publication. A summary of that, the study design, population who are affected, contributing factors, outcomes, and many things in this view. I've just brought it here that to show you how many things are relevant with each other and how you can use the art of illustration and visualization to show the contributing factors, predisposing factors, social factors, equity factors, personal factors, genetic factors, and everything that is relevant to your issue. Don't think about one issue from just one island or one isolated perspective. Be a systems thinker and think about many other things that are relevant to issue. That's another thing that I've seen before in the journals, that they are using this kind of components in publications. For example, this is what is already known on the topic. The topic is rare thrombocytopenia and thromboembolic events after COVID-19. That's the topic. But the section of what here is what this study adds. This study adds increased risk of this event, venous thromboembolism, and other rare arterial thrombotic events. So this is important to know how you can describe what your study adds to the current literature. That's important to have it in your mind. This is a good example of issue statement. You have 2 minutes to read it carefully, and after that we will discuss it. Can you see it? Is it readable? Okay, great. 2 minutes.
It is, Dr. Marsman.
Thank you. Are you ready? We need a volunteer. What type of contributing factors have been discussed here? What type of factors contributed to you? Please reply.
Hi, Dr. Marsban.
Hi, dear Maya, please.
Yeah, I tried to read it fast. My understanding is we are comparing two vaccine side effects as a primary outcome, right?
That's right, but the topic is risk of vaccines
Yes.
regarding thrombocytopenia and
Yeah, thromboembolism.
thromboembolism. Yeah.
Yeah,
And
and these are side effects of probably two vaccines.
AstraZeneca, AstraZeneca
Exactly.
compared with others.
Exactly.
But that's the topic, Mariam. What contributing factors, what items, what components? We discussed the components that should be discussed in issue statement. What components have been
COVID-19 vaccine, right?
Yes, about COVID-19.
Yeah, our intervention is COVID-19 vaccine that we are focusing on.
Great, that's right. But what factors under this topic? The topic is vaccination. The topic is an adverse event after vaccination.
Exactly.
And it uses the methodology of comparing AstraZeneca with other vaccines. That's okay. That's the topic. But how it discuss this issue in a good issue statement.
I'm trying to get to your point. We are evaluating the short how they discuss it.
Public safety.
Please. I'm hearing you.
Yeah, it's used in public safety versus withdrawal of the vaccine, like the consequences. It's social.
Yes, the first factor is safety. Safety, risk benefit analysis. You see here, risk benefit evaluation. That's one of the factors. Adverse events was a part of the title. So that's the other. Balancing risks and benefits. You see here, safety evaluation is the other component. And there are many facts and figures here. How many doses have been already administered worldwide? This is one of the factors. 7 times more infection rate. You see, this is another factor. Or thrombosis risk associated with this compared to the vaccination. Those are facts, figures in an issue statement that discusses many things. Countries who have reported these risks, different companies, and it addresses many resources and references that have discussed the adverse event of AstraZeneca in different countries, even in United States that hasn't used AstraZeneca as a vaccine, as a popular vaccine here, but still the issue statement addresses United States usage of vaccines, including AstraZeneca. And one study from United States estimated something about AstraZeneca. So there are many things in this issue statement. All of the facts, I'm sure that now is not a good time for your reading because that's afternoon, evening, and you're tired, but please read it tomorrow, tomorrow early morning, or but just the morning to be focused on how this author plays with words, facts, and figures to demonstrate the importance of this issue and how it shows and demonstrate all of facts that you need to see in just one page. In a one page, everything that you need about AstraZeneca and about embolism or thrombolytic adverse events, it describes you in a very consolidated and scientific way. Just read it. I recommended my research fellows to read it 5 times because it's very interesting how to use the wordings and how to write about scientific facts to show the importance of your topic and to make a beneficial reading for your readers, for the people who are reading your reports and your articles. So just think that the author can write something about importance of COVID. COVID was a tragedy, a drama, something like that. It affected millions of people. But what was the additional value of writing in that manner, in that style? Only writing, only filling out the page or submission of the article to a journal for publication. That was the value of just writing and filling the pages and filling the lines. But here in this page, you can find many facts, many important, valuable facts just in 2 or 3 paragraphs. I want to recommend you and motivate you, incentivize you to use many facts in a very short and brief and consolidate and relevant, rational manner in your issue statement to brief and to explain the readers how is the importance of your program, how is the importance of your article. That's the most challenging part. And after this issue statement with a lot of insights and facts and figures, you would be able to build your structure of the research, to build the framework, to build the infrastructure of the project with these facts. So after all of these justifications and reasoning for why this research is important, the author talks about what is the additional value of this research. We evaluated the risk of pre-specified secondary outcome of interest, name something, ischemic stroke, myocardial infarction, and other. So he or she, I don't know who is the author or who are the author's team, but they are describing what would be the additional. The first part are why section, and this part is what section, how this report, how this project adds a value. Okay, have it as a good example in your mind. This is the second one. Just read it in 1.5 minutes or 2 minutes, please. Sorry. Okay, let us know how is your analysis comparing this one and the last one.
In this one, Dr. Masban, there is no justification of primary and secondary outcome of the study by itself. It's just general information.
Great, great. That's the point, Mariam. That's the point. Only explaining something. It's from PubMed.
Yeah, surprisingly.
It's from, yeah. It's from PubMed. Last one was from BMJ. Both
okay.
of them are reputable
Yeah, well reputed.
database, but there is many difference. When you see here is only what was the team 11 combating SARS-CoV-19. It's
Exactly.
respiratory illness, pandemic.
General.
Many people tried to combat 9 vaccines. And there is nothing in here to show
It looks-
something to you.
it
No
looks like
value
a-
for reading that.
Exactly. It looks like a proposal introductory phase you do,
Yeah,
but
yeah.
nothing about the study.
So because of that, I selected these two to show you we can write many things and we can publish many things, but the value of your writing, the value of your proposal, the value of your research is totally different. If you put enough information, enough energy and passion and scientific skills into it, that's a scientific skill. To know how I can state the issue of the research. You can write many things and publish it, but it's not enough for a physician scientist, for a person who tries to spend his time or her time to make a change, to make an impact in community among colleagues, peers, readers, scientific, medical literature, everywhere that you think. So please value your time and be equipped with these skills, how to write issue statement that is the most challenging and most essential instrumental part of the research. Okay, we talked about this. What is the why section and what is the what section? So we talked already. After what section, we will have research questions. And we will talk about research questions and how you can identify, how you can define research questions with some methods. But let us again review what are the purposes of the why sections: improving prediction, increasing knowledge base, having a social, organizational, or institutional impact, measuring change or improvement. Measurement is important, helping one understand complex phenomena because of complex system. The thing that I showed you, this picture, was a description of a complex phenomena, complex system. And remember that healthcare issues are complex systems. And complex systems are including the many factors, many phenomena, many influencers that are interconnected to each other. That's the topic of industrial management, systems thinking, systems design, complex system, and many things, many theories and toolkits and methodologies are based on these concepts. So it's important to demonstrate your topic, your research in the issue statement as an interconnected phenomena, as a complex system that is relevant to many contributor factors. And after all of these sections, we will have research questions. After having a journey to show contributing factors, predictive factors, influencers, how they influence, connecting those influencers with the phenomena, with the condition, with the disease, and showing the complexity of the disease, how it affects, how thyroid function, how a cancer, how a cardiovascular disease, how a virus infection can influence many aspects of our health status. All of them should be included here to bring us to a good research question. An understanding of past events is a part of that. You review this issue statement, how it shows the past events, how it describes the facts and figures, epidemiologic facts and figures, statistical facts and figures, effectiveness facts and figures, safety facts and figures. There are many things that should be shown in an issue statement in a well-described and well-written issue statement to justify your research, not for others, but for your team, to build a frame for your research after having this issue statement. And also stakeholders. Who are stakeholders? We will talk about it later because it might be not relevant to clinical issues, but about quality improvement. It's very important to address different stakeholders who are a part of the process, who are a part of the improvement. Okay, so this is another perspective on issue statement and how to analyze the problem, identify the core problem, identify possible contributing factors, determine relationship between the problem and contributing factors. That was the connection that I told you. The connections between contributing factors and the problem is very important. How those contributing factors like safety, like effectiveness, like cost, like different countries, how they are connected with adverse events of a vaccine. You reviewed and experienced a good example of how a good author writes the meanings, writes the aspects, different aspects and interconnectivity of influencers and the phenomenon and the main topic. Regroup the contributing factors into broad categories. I will show you how you can do it. Decide on the focus and the scope of the research at the latest part of the issue statement. So this is the worksheet. This is the table that we will work on it in our worksheet. You have a core problem, please state it. Then describe the importance, magnitude, affected population, then possible contributing factors, then relationship between the core problem, then global, national, local facts about that, socio-ecological. Please search it after this presentation or tomorrow or the day after to see what is socio-ecological factors, what are social determinants of health, equity, cost, and economic impacts of the issue. And then at the latest part of your issue statement, bring a scope of research and research objectives. Okay, that's the interconnectivity of the title, the problem, purposes, research questions. Those are very interactive together, and we will experience through working with together on our worksheet. We will share worksheet after this. Please let me know if you have any question, any comment right now. I'm listening. Thank you so much for spending your time with this presentation. Please share your ideas.
I have a question, Dr. Marsman.
Please.
Thank you very much for teaching us all of this. Really appreciate it. And about the writing the problem statement, the first paragraph is kind of, we are explaining our main outcome, right? The primary outcome.
Yes.
And try to justify that.
Not just primary outcome, the primary topic, Mariam, primary topic, the main topic of the project. Primary outcome would be mentioned at the latest part of the issue statement. What do you want to measure it? You know, the outcome, measurable outcome of the study will be discussed at the latest part of the issue statement, and then in the method. In the method, you will describe objectives, what would be the measurable outcome. Yeah.
Thank you.
Thank you so much for a good question. That was helpful. Okay, you can see my screen? Or
yes.
Okay.
No, we can. No, we can see you.
Sorry. Is there any other question?
Oh,
Whether you want to
yeah, we
say
can't
something?
hear
We
you,
can't
Dr.
hear you.
Sorry. Can you share your PowerPoint? Email it to us.
Yes, we have emailed it, Laura.
Yes, I emailed it this afternoon. I emailed all the material to all of you. Let me know if you did not receive it. I will email it
All right,
again
thank
to
you.
you,
Thank you
Dr.
so much.
Sabin. Yes,
Thank
just
you.
let me know, please.
Sure.
Okay. This is the worksheet, dear friends. The worksheet, and let me, oh, I cannot maximize. Let us make it bigger. Okay. This is the worksheet for this presentation. The first step is why the study worth conducting. If you have a topic that we will help you to select your topic. We have discussed your topic today with our research fellows. Dr. Elias topics, Dr. Jansi topics about ketamine, about EEG studies. We discussed Dr. Nicole topics about hypernatremia at a disease and AKI in ICU. So we discussed many of them. Dr. Samuel, we discussed partnering with industry about ophthalmology intervention. So, and we discussed Dr. Jonathan about medical cannabis. We discussed many ways to be more efficient per oral or IV steroids. So we discussed many of these topics today, and how we can navigate your ideas to be a research topic. Those ideas and suggestions are very important, very valuable, very valuable. So we have a treasury of ideas right now. Don't give it so easy that this is just an idea. Please value your thoughts. Please value your ideas, your proposals, because all of them potentially are research projects. And this is our role, how to assist you, to help you to transcribe these ideas and turn your idea and thoughts into a project. All of them have the potential. This is my opinion about the things that I received from Dr. Shiruti, and I value all of them. They should be only shaped and navigated and coached and mentored to be a research topic. Even we discussed the methodologies together, how the methodology, different methodologies fits your idea to be a scholarly activity, to be a publication later. So please work on this worksheet with these steps. First of all, justify the value of your topic. Then what has been done in the field before. Gather the data, the facts from literature search. I want to say now that the next module would be evidence search, review of evidence, and skills that you need to scientifically and skillfully search the evidence from databases, and what kind of databases and evidences are valuable and reliable for you to search them and gather and collect the facts and data from literature. So the next module would be very important, and your prerequisite for entering the next module is having these two worksheets. Without these, you cannot continue this participation because you cannot contribute to the work as a research training lab. So please do it on time, and Laura will communicate you, our research fellows as well, and reply to these questions. We already discussed all of these phases together. That's the other part of the worksheet in 6 steps. First of all, explain the core problem, not measurable outcome. Yes. The next one would be importance, magnitude, affected population. Gather data from literature. Check the connections, because connections should be here, not in different or separate section. Bring statistical facts and statements, like the example that I showed you. Globally, nationally, US-based, state-based, local hospital base. If you have some data at Larkin, please bring it from your department, from previous published articles at your department. What are the impacts of the issue and its contributing factors on economic burden of the disease? Please search this word. It needs one meeting to discuss it. Economic burden of the disease, cost of solutions, cost of treatment, socioeconomic status of affected population, social determinants of health. Those are important factors that makes your manuscript something unique for publishers. When you discuss disparity, when you discuss cost of a disease, when you discuss socioeconomic status of affected population, it makes your manuscript distinguished and differentiated from other manuscripts. So you will receive a fast acceptance from the journals that are reviewing, but only because of this. I know it, I'm sure, because I was working with them. That's very important part of a manuscript, to value the economic impacts of the disease condition, the cost of that, at disparity and equity consequences of the disease. And at the last part, how does the study address and close the gaps? What is the added value of this study? What's the scope of research and its objectives that is relevant to research questions? We will discuss it later in our next modules. So here is very short and brief introduction to literature review to make you competent and confident, comfortable for searching the evidence, PubMed, Scopus, ScienceDirect. But I'm sure that Angela and Marzieh, that I appreciate here from all their hard working to provide these writings for you, they will bring other aspects of literature search and literature review later. They will share guideline with you later. So, and I know that Angela and Marzieh are working on a good example of writing, a good example of this worksheet to be a pattern for your work, to feel more confident and comfortable to write this worksheet for us. So this is the worksheet, and you have also an instruction that explains everything for you. And I appreciate Angela, you are working right now. This is Angela. Okay, so we have worked on these writings last day until 2 early morning. You believe? We were working together on these Google documents together to write this for you. Please spend your time. We know you are busy, but it is worthwhile. It makes a lot of differences in your future career advancement and career promotion. So these are examples here, rather than the example that you had. You have many examples here about how to write an issue a statement. And this is again a description of the worksheet and sub problems, how you can connect all of these together, and some references. And here you can find something about searching literature and how to search the databases and the search strategy. So here you have a search strategy, how to use or, and not in your search strategy from PubMed or other databases. Example of PubMed search, how you can search the PubMed with a good search strategy. This is an example of that. So I appreciate all your time and joining today, and I don't want to make it more longer. We have 3 minutes for questions and answers, please.
Hi, my name is Mohammed. I'm one of the fellows, pulmonary critical care. Thank you for a very good insight about this, Dr. Marzban. Really appreciate that. My question is, like, when you're writing these research statements and going through the different steps, is there any I mean, is it the same if, say, for example, we have a QI project? Can that be, we need to follow the same steps, the same rules, or is it any different?
Great question, Dr. Mohammed. It's really an insightful question. So I'm glad that you brought it up. But about the clinical studies, you need to address contributing factors because we need that. For example, the preventive factors, the treatment factors, the personal factors, family factors, race and ethnicity factors, the genetic factors, gender factors. There are many things, SDOH. So there are many things in clinical writing and in evidence review, in case reports, and in case series, because you are describing, for example, a cardiovascular disease topic. So you should include all of those. But there is a huge difference when you're describing quality improvement project topic. For example, you want to address a communication barrier, a gap in administration, a gap in education, patient and family education, in physician training shortcomings or gaps on or teamwork shortcomings. So the main rules are the same. Thinking systematically is the same rule between all those, but contributing factors, predisposing factors, influencing factors are different in quality improvement, because in quality improvement, the factors that influence the phenomena is policies, procedures, regulations, forms, documents, education, awareness, top leadership, management, IT, technology, manpower. There are different contributing factors and influencers. Proximally and distally, there are different reasons and different factors that affects the main problem, the main issue. So the core rule is the same. The general rule is the same. Consider everything that is relevant to that fact, to that main idea or main topic, and then categorize those factors in a good manner, not scattered and without any rationale and without any mapping. After that, you should recategorize and address everything in a good place, in a well-designed mental map. But contributing factors are more clinically in the clinical discussions. In quality improvement discussions, those are mostly leadership-based, management-based, communication-based, education-based, awareness-based, IT-based, and something like that. Does it make sense?
Yes, that clears it up very much. Thank you very much.
Thank you. Thank you so much for your good question.
I want just to give a message to everyone. I just write our website link on the chat. There you are able to see all the materials in every of the training labs. They're posted already there. I just gave the instructions in the chat and the steps so you can get to them. And you have to create an user ID and a password in order to access the information. If you have any questions, just let me know. Contact me via email or in the Telegram chat.
Thank you, everyone. We want to have it just in a 1 hour. Please, Dr. Arshad.
Hi, Dr. Mothman. Thank you very much for your lecture. We have a question. One of the pulmonary fellows, and we have a number of topics that we want to do some studies on and write it up. We just want to know, we're new to this forum, how much help can we expect from your team? Or is it more on for the teaching, like how to conduct the research, or your team can help us with, like, say, the literature review or the statistical analysis or any of the help we can get from your team, or?
Thank you, Dr. Arshad. That's a general question, I think, for many of you. So thank you for asking this. Research fellows that are working with us closely in our department are only four IMGs for doctors. So there is limited capacity to receive mentoring and coaching and guidance from their side, but they are trying and they are applying their best to connect you with my mentoring in a small groups. If you are, for example, 5 people in a small group, we will schedule a Zoom meeting to shape and form your ideas and define your topic, define your project. And after that, we will navigate you to have your proposal. But for writing proposals, for search of evidence, for library assistance, for example, for methodology design, data analysis, journal subscription, and something like that, we have Team 11. Team 11 is a group of IMGs, very interested researchers, very experienced people that help Larkin to publish these types of articles. They are interested to communicate with our projects as a team member. So there is a good chance with having Laura here, because Laura knows many of them, and Laura will identify which one is a good connection for your team, for your topic. So we will work together after having the first meeting within a small group to shape your project. And after that, we will connect you to researchers from Team 11 to assist you in writing, data analysis, even in journal submissions, because they are experienced. Many of them are very valuable contributors and collaborators in research. Just communicate with our research fellows first of all. Those are helpful connections to receive your request, to receive your topic, and after that we will organize everything to assist you. Okay, thank you everyone, and good evening. I'm hopeful to receive your feedbacks and your worksheets very soon. That's the best result from your end to reply our efforts and energy that we've put into this program. Thank you so much and have a very nice time.
Thank you.
Thank you,
so much.
Laura.
Thank you.
Thank you, everyone. Thank you.